Hi, I'm Dr. Becker, and Calici virus, which is also called feline Calici virus, or FCV, is a common respiratory disease seen in cats. Along with feline herpes virus, Calici virus causes the vast majority of upper respiratory infections in cats. The virus infects the respiratory tract, including the lungs, nose, and mouth, and can cause ulcers on the tongue and affect the intestines and musculoskeletal system as well. Calici virus is highly infectious and is actually most often seen in shelters, catteries, and other similar facilities where there's a lot of kitties that are housed together in a potentially very stressful environment. It can occur in kitties of any age, but kittens over 6 weeks of age seem to be the most susceptible. There is a vaccine against Calici virus that many veterinarians recommend. I am not one of them. It's a little bit like the kennel cough vaccine for dogs. There's ample evidence that the vaccine is virtually useless in decreasing the prevalence of the disease. And remember that more Calici vaccines, or giving Calici every year, doesn't necessarily offer more protection. So because the majority of cats have been vaccinated against this virus as a part of their combination kitten vaccines, continuing to revaccinate cats year after year does nothing to foster additional protection. So I'm not a big fan of repetitive Calici vaccines. Calici virus is spread in the air when an infected cat sneezes. As the droplets fall on the ground, then they contain this infected virus particles, and then they contaminate the surfaces that they land on. The virus can also exist on dust particles and dander. Calici virus can also transfer to objects an infected cat uses, such as food and water bowls, litter boxes, and bedding. Other cats who come in contact with these objects can then be infected. Finally, the virus can be transmitted through direct contact between cats. So if a healthy cat is exposed to an infected cat's saliva or nasal or eye discharge, then they can become infected. That's one of the reasons that I recommend, if you have a naive cat at home, if you have a kitty that has never been vaccinated for anything, which is totally fine because he never goes outside, never exposed to any other kitties, if you find a snot-nosed kitten in a parking lot somewhere, that's why it's really important that you not bring home a wild kitty or a feral rescue or a stray kitty. You should bring them home, but you don't expose those stray kitties to your cat at home, because these are the types of infections that can occur with one encounter between an infected cat and your healthy cat, and your cat is infected with Calici. The Calici virus mutates very, very easily, which means there are many different strains of the virus, and there's many different strains that exist in nature, some of which can cause more serious diseases than others. Calici virus is most often manifested as an acute upper respiratory infection, with symptoms that include sneezing, runny nose, and pink eye, which is conjunctivitis. Kitties can become lethargic. They typically, because they can't smell, they lose their appetite. They can run a low-grade fever. There can be monumental difficulties breathing. There's a lot of mucus and snot. There can be coughing. And in the cases of very young kitties, certainly pneumonia can develop. Symptoms typically come on suddenly and can last from a few days to a few weeks. Additional symptoms of Calici virus can include the development of ulcers on the tongue, as well as the hard palate, as well as the lips and nose and mouth. And in rare instances, actually, there can be inflammation of the joints, which can result in painful walking. Those are very rare cases with an extremely virulent strain of Calici. Most of the time, it's the traditional cold that cats get. Rarely, Calici virus can manifest as virulent systemic FCV, which involves a highly pathogenic strain of the virus, which can affect organ and blood vessels. Again, very rare. Your veterinarian will take a thorough history of your cat's symptoms and perform a physical exam. He or she will also complete a CBC and a chemical blood profile, which means take some blood and find out what's going on the inside. An FCV antibody test will also be needed to evaluate the level of calicivirus antigen or antibodies in your cat's system. A more advanced test can also be performed that involves growing isolated viruses using a technique called cell culture. Your vet may also take a chest x-ray to check for changes in your cat's lungs, or just to make sure your cat isn't fighting pneumonia. The vast majority of cats with very mild infections, which is most of the cats infected, do not require veterinary care. But cats obviously with pneumonia or a bleeding problem will need to be hospitalized and stabilized, and secondary infections will need to be managed. Sometimes young kittens absolutely just need a round of IV fluids to correct dehydration, and sometimes nutritional support is offered as well. Steam inhalation or nebulization with colloidal silver I have found to be very, very effective for these young kittens, especially with severe nasal congestion. And that's something that I find very, very helpful when managing oftentimes a litter of kittens that come in infected with this virus. I also use a lot of homeopathic nosodes in these situations with really nice results. You can also use immunostimulants such as olive leaf and arabinogalactans. Cats recovering from Calici virus infection require excellent nursing care, including making sure that you're cleaning out snot, crusty eyes, making sure that there's no buildup of gooey secretions in the eyes, ears, nose, and throat. Cats with FCV need to be encouraged to eat, especially because they can't smell their food. So gently warming your cat's food along with raising the bowl so that the aroma is closer, maybe using some bone broth or some gently cooked chicken or a topper to get them eating could be important. The prognosis for kitties and cats with Calici virus really depends on the severity of the symptoms, with most cats recovering in about a week, but in severe situations, sometimes it can take several weeks for a kitty to make a complete recovery.